One of the challenges we have is that we have fairly rigid criteria for what constitutes a response in myelodysplastic syndrome. Interestingly, in MDS, a complete response still allows for a background of dysplasia. We never really get rid of this disease entirely unless a patient undergoes a hematopoietic stem cell transplantation. So these response criteria continue to allow dysplasia, and what they define as a transfusion independence response, for example, is one that lasts for 8 weeks. Well, that may make sense statistically, but if you think about it from the standpoint of an older adult with myelodysplastic syndrome, is it really worth that patient getting rigorous treatment for weeks on end to then achieve a response duration that only lasts for 8 weeks? I think not, and my patients think not also. So in response to that, we've come up with some modified criteria that actually ask for a response duration of 16 weeks, because we think 4 months is a more clinically meaningful duration than just 2 months. We're also trying to steer away from an arbitrary rise in a hemoglobin level to define response. So the IWG criteria demand a hemoglobin rise of 1.5 grams per deciliter that lasts for 8 weeks. 1.5 grams per deciliter may be very meaningful in a person who's severely incapacitated by his or her anemia. It may be meaningless in a person who, for example, has a hemoglobin of 8.5 and is able to attend to his or her daily activities. So we're trying to align these criteria really with a patient's goals of care, and we think actually the best path forward is to define those goals of care with the patient before you even get started on therapy. So then you can see if what you're achieving is actually meaningful to the patient you're treating.